Quite nice. This is my son Nicholas. Yeah, that is his first haircut. I thought, what a face. I got to get a picture of that. So he was not happy. He was like Samson with the hair, you know. So I finally got him cut. Now he wants a haircut every other week. He said it's enough, you know. Yeah. But it's a cute face. Love that kid. Anyway, bunion deformities. There they are, guys. See the bunion? 1/3 of the people have a bunion deformity, okay? So it's relatively common, all right? The cause could be you're just born with it. I'm not going to say that your parents mashed you into a tight shoe, although we like to blame our parents. I'm doubtful on that. I'm doubtful. I don't think your parents did that to you. I think you were just kind of born with it and it developed over time. Here's a bad one. See that one? Boom. What it is basically an abnormal angle between two bones. That's really what a bunion is. So you can't really get that by just wearing a bad shoe. You have to have a setup for it. Conservative treatment is basically living with it. If you don't want to live with it, then you're left with having a surgical correction. So inserts in the shoe and this kind of thing don't really help bunions. It's really living with it with a wider shoe or a pad. And if we correct it, like this person has a bunion, we actually cut and reposition the bone and put some screws in it, and then you walk in 2-3 days and you got the bunion cured. So not everyone needs a bunion correction, but if it's hurting, then you get it done. So, and bunion surgery can be complex. Take a look at this foot. I mean, if you guys have feet like this, you're going to come yelling at me. You're going to say, hey, Mike, what the hell, what are we going to do with this, Uh-oh.
You got that problem.
Oh, I wouldn't tell on people. That's not nice.
All these years, nobody's been able to do anything about it.
Well, I do things for it, but...
I had mine operated on. It just comes back.
Yeah, well, it's got to be done the right way. The foot's complex, but,
I'm going to have it done the second time.
Well, you might be out of the surgical realm now. We might just leave well enough alone, but...
Too old.
Yeah, but if you need something, if it hurts you and it's preventing you from walking, you come see me. I'll figure something out. That's simple.
Where can you buy shoes? Don't say soft shoes. Because I go around feeling tops of shoes.
Yeah. I mean, the shoes are a hurdle today. I mean, don't you guys think so? I mean, we've lost, everything is made elsewhere out of this country. The shoe sizing is all messed up, and some are of different quality than others, yet they charge an arm and a leg for these things. So, I hear you. Shoes are complex, but in any sense, if you have this type of deformity, these are severe deformities, but it can be corrected, it can be corrected. So you can see over here that this is a correction, this is good, the anatomy is restored. And it's a little more complex than any of you folks would want to have, but, you can make things better. So this side was worse. This was worse than this side. This one's corrected. This one is not corrected. Okay, so you can see that you can get them corrected. So the other thing we do, especially when we have patients that are on the beyond 60, is joint replacement. Just like Central Maine Orthopedics has a great knee replacement program. If you have an arthritic knee, you got to have it replaced if it's hurting you. Similarly, I replace joints in the foot. So this is someone that has an arthritic great toe joint, and believe it or not, we can replace that. That's a picture of it being replaced. Say that's an implant in a great toe joint. There's the arthritic joint. It's hurting someone real bad. Boom, it's replaced. You see that? That takes probably about 20 minutes to do in an operating room, and you walk the next day. Pretty simple, although it looks complex. If you have pain. Okay? So, and you can see that we can get back the motion. Okay, we're into the diabetes. You ready? Everyone following along? Good? Diabetes, big deal. 82,000 amputations a year between 2000 and 2001. They haven't done these statistics in a while, but that's the nuts and bolts of it. People lose their legs with this diabetes problem. 18.2 million Americans are diagnosed with diabetes. 5.2 million are currently undiagnosed. 6.3% of the population and rising. Number one cause of hospitalization is a foot problem in diabetes. So the good news about diabetes is most of these problems are preventable through proper care and regular visits to your podiatrist or foot and ankle guy. The feet need to be watched either by your primary care doctor or a foot guy or girl. I hope if you guys are diabetic, you're having your feet watched, because that's where you're going to get a problem if you do get one. Okay? So here's some simple diabetic guidelines. Inspect your feet daily. Moisturize your feet daily. Trim nails carefully or have someone professional do it. Avoid trimming calluses. Check your sugar levels daily. Always inspect your shoes before wearing them. Never walk barefoot. No smoking. Periodic foot exams by a foot and ankle doctor. And, you know, these things are paramount if you're diabetic. Most of the diabetic problems I see are things that could have been avoidable, okay? One study shows that you'll reduce your rate of having a foot problem as much as 200% if you're followed by a podiatrist regularly. Avoid heat as a diabetic. We're approaching winter. I don't want any diabetic putting their feet near a heat source, whether it's a wood-burning stove, a radiator, a fireplace, heating blankets, blow drying your feet. It's funny, but this person blew dry her feet. You know, what was this? This was Joan. This was about 6 years ago. This is my patient. She blew dry her foot, you know, and burnt the damn thing. And we're not good. These are like substantial third-degree burns, but you know, so you say, well, who the hell would blow dry their feet till they burn? Well, one of the big things that goes with diabetes is temperature interpretation. You don't feel the very cold and you don't feel the very hot. And your body tricks you and it makes you think that you're cold when you're not. And she was just getting warm. Well, you know, didn't work. I've also had a diabetic lose his toe because he went out in the cold weather to work on his car in the garage in sandals. And his toe got frostbite, and he didn't even know it. You know, he did not know it. Yeah, so this stuff can happen. The temperature is a big deal. Okay? Ah, that's my fish. What do you think of that fish?
Cool.
Yeah, I thought it was pretty good. I caught that fish. It was a big deal for me. I was looking for that fish. And that's my son Michael, and that's Nicholas. That's him before the haircut. And that's me. I got the fish.
Yeah.
So, do you guys have any questions? Yes, please.
Well, I was jumping in, but
Please do.
I keep going back to my doctor because I'm having trouble with the second toe from the baby toe.
Yeah.
And so I should see a podiatrist, have her recommend me to a podiatrist because we're not getting anywhere and it's not getting any better.
Well, I don't know, what kind of problem are you having?
Well, it's swollen and it's purple.
Yeah.
The x-ray, there's no break.
Yeah, I mean, I would have it focally looked at, you know. I'd be, you know, like I said, I work over at Central New York City, so I'm happy to take a look at it. Yeah, I would get it checked. Yeah, you can't, I mean, if something, I always like that 3-week rule, okay? If it ain't getting better in 3 weeks, you probably got a problem, you know? I mean, I use that for myself, you know. I say, well, gee, my knee is hurting, but maybe I could just give it some time, you know? And, you know, if it doesn't get better in 3 weeks, it's probably something going on.
Yeah, I mean, I told her I'm diabetic, so that's my concern.
Oh, yeah, no, if you're diabetic, I just showed you the statistics, and I don't care. If you want to see me, great, you know, you seem nice, but if you don't want to see me, you got to see someone. And the insurance companies eventually, guys, are going to, like, mandate this stuff. They're going to say, hey, if you don't see a foot and ankle doc, you know, they're going to, like, be telling us what to do eventually. But the insurance companies say that you are supposed to see a foot and ankle, you know, podiatrist thereabouts to have your feet checked and to have appropriate footwear and all this other stuff, you know. It is important, it really is. I mean, Any other questions? Yeah? Yes, ma'am?
What about peripheral neuropathy?
Neuropathy, yeah. Neuropathy happens with diabetes. It happens to most of diabetics to some degree or another. One of the first things that happens with neuropathy is that temperature thing. Okay, and then it can get really weird. It can get like severe neuropathy where when you see a really bad neuropathic patient and walking down the street, they look drunk. You know, they lose their stability and they, you know. So neuropathy is a big deal, and certainly there is titrated or levels of care that you base your treatment on, depending on how bad the neuropathy is. Sometimes it's just a pill if it's keeping you up at night. Sometimes it's cream. Sometimes it's bracing on the ankle to get you stability if you're that person that's really unstable on their feet. So, yeah, you know, that's something that certainly should be looked at and treated if it's an issue. Any other questions? Great. I have questions for you. Are you prepared? We are going to see who is paying attention. How many bones are in the foot? Come on. Come on. One of you guys.
26.
Who said it? You? Boom. All right. Good job. Good job, ladies. 26. How many steps does the average person take a day? Who said it? Boom. 10,000. She gets 1 point. What causes a hammer-toe deformity? This is a tricky one. Think back, I showed you my finger, not the bad finger. Remember? Remember what I said?
Shoes are too tight or something?
No, remember I said it wasn't really shoes.
The muscle.
Muscle imbalance. Look at you, 2 points. All right. Oh, look at that.
Once in a while. Hereditary too.
You know, unfortunately or fortunately, I think our genes play a role in most everything, don't you? You know, you guys are looking at each other, and I'm sure some of you are saying, how can she do that? And, you know, here I am, and I can't do that, or vice versa. And, you know, hopefully I've been blessed. I told you my grandfather was good at 96, so, you know, I thought, hey, that's pretty good, you know. When my grandfather was dying at 99, because he almost made it to 100, you know what he said? The doctor asked him, he said, geez, George, you know, if you could go back, what time did you like the best after, you know, your whole life, you know, when was you? And he looked over at the doc and he said, geez, I felt really good at 96. It's true, and he wasn't joking around. He was just, you know, he had a good life, which is cool, and I hope everyone has a good life. And you guys all seem like really good people. I'm happy you let me whisper in your ear. So again, have a good remaining lunch or dessert. Thanks for coming. Okay?
Thank you.
Yeah, you're welcome.